Okay, to make the best of our hour together, or close to 1 hour, I think we will start. We'll leave our introductory slide up for just a moment so our folks who are just joining can see who our panelists are. Um, I'd like to get us started. My name is Laura Wilson, and I work in the Cedar Knolls office of Finger Paint, and my role is patient strategy. I'd really like to welcome all of you here today and thank you all for joining as we learn about experiences of living with and managing rare disease in advance of Rare Disease Day on February 28th. As you're seeing on our opening slide in today's session, we're going to hear from 4 people affected by rare disease, each with a different perspective and experience. And while each of our 4 panelists may share some common experiences primarily related to cystic fibrosis, we're going to hear from them about their unique situations even within that disease state. And so before we start, I want to be sure to express my appreciation and that of all of the finger painters to our panelists, excuse me, for your willingness to share your personal and professional stories with us today. So I think so that we can all see each other well, I'll ask Lindsay if you can take down our opening slide. This way we can just see as many people as possible. I'll ask everyone who is not a panelist to please mute so that we can make sure to see them and hear them clearly. I will tell you that our discussion today, we have a few prepared questions, but we are hoping to have time at the end for question and answers. So for folks who would like to ask a question of one or all of our panelists, please feel free to put it in the chat and direct it to me, Laura Wilson, Laura W, Patient Strategy. And with that, we'll get started. So I'd like to take this first moment to have each of our panelists introduce themselves. And the way today will work is I'll put a question out and call upon each panelist, since we're not all in the room, just so everyone knows when it's their time to speak. So in terms of introductions, we're going to start close in with a member of our Finger Paint family, Steve Bell.
Hello, everybody. My name is Steve Bell. Some of you know me, others don't. I work in the Jersey office on the brand strategy team. I also have cystic fibrosis. I was diagnosed at a very young age when I was 3 months old. Lived a fairly normal childhood in the world of CF, a balance of trying to go to school and stay out of the hospital, but that inevitably did happen. And that was just part of the upbringing. You know, I'm fortunate enough where I've been able to maintain a good semblance of my lung function for most of my life. And then 2.5 years ago, I was lucky enough to start a clinical trial for a class of drugs that has changed the trajectory of my life. I've been on the drug for nearly 2 years now, and I've been exacerbation free, hospital free, and kind of have a new lease on life. So it's really an interesting shift in mindset as you live your life and what to expect. I also stay fairly active in the community with the Boomer Esiason Foundation and Team Boomer. Exercise was always a critical part of my life, and you know, I played soccer growing up, played soccer in college, and after college I turned to running with Team Boomer and have since run 9 marathons and a couple dozen half marathons, and I think that's really been a key to my physical wellness, but also my mental wellness, because they're all interconnected. So that's sort of my story. You know, I'm fortunate enough where I'm in a place where my health has exceeded my expectations. I have a wife, I have 2 little kids, and I'm able to plan for the future. And that's something that I honestly never thought I would have. So that's a little bit about me.
Thank you, Steve. Next, we're going to go one ring out to another member of our extended Finger Paint family, and I'll ask Lauren Spitzer to introduce herself.
Thank you so much. I'm Lauren Spitzer. I'm the wife of Andy Spitzer, who works at Finger Paint, if you have heard of him. And I am mom and caregiver to Mickey Spitzer. Mickey is a 6-year-old little boy who was diagnosed with CF-related metabolic syndrome, mouthful. They call that atypical CF when he was 2 months old. And the pediatrician had never even heard of that. He said, don't worry about it. He wrote on a Post-it that he would just be a carrier. And I saved that Post-it as sort of a ticket to not just being Mickey's caregiver, but finding my place as an advocate and trying to navigate healthcare for somebody that really can't decide for themselves what they're going to do for their own well-being. So I've learned really quickly that doctor selection is really important. And we started the Mighty Mickey and the Fighting Pickles team in 2015. Some of you have been able to participate in that with us. And that group is dedicated to raising money and awareness of CF and really working to raise money until there's a cure for every patient. We are really lucky in our family that in every year of his life, there's been a major pharmaceutical breakthrough. In 2020, that breakthrough is the first that Mickey will be eligible for. So overall, we've had some really impactful and positive experiences with our community, and we are really grateful for anybody who is interested in working with us.
Lauren, thank you so much. I'm so glad you're here with us today. Next, I'd like to ask Emily Kramer-Golenkopf to introduce herself. Emily of Emily's Entourage.
Thank you, Lauren. Thank you so much for having me. I'm thrilled to be with all of you today. I am an adult with cystic fibrosis. I am also the co-founder of Emily's Entourage. As Steve mentioned, and Lauren too, there have been really revolutionary breakthroughs in treatment for CF in the past few years for roughly 90% of the CF population. And Emily's Entourage is focused on that final 10% that unfortunately doesn't benefit from any of them. I'm part of that group, and there is a whole community of people just like me who are still contending with the same killer disease that CF has always been. And we at Emily's Entourage believe that everyone with CF deserves realistic hope for deep breaths and healthy long futures that are, not dictated by CF. And that's what we are working for every minute of every single day. Briefly, about me and then about the organization. So I have advanced stage cystic fibrosis. I have about 33% lung function. And I was diagnosed at 6 weeks old and have spent, a lifetime trying to delay progression of my disease as hard as possible. Unfortunately, it's not always that easy. And if it were, people like me wouldn't find themselves with 33% lung function and worse. And so it's really a cruel disease that resists negotiation and the best care and the best support and, the hardest work, none of that is enough to effectively halt the progression of the disease. So we started Emily's Entourage back in 2011. We were seeing the game-changing breakthroughs coming down the pike and feeling unprecedented hope in the CF community. But we realized that there was a group of people that were being left behind. And so despite having no background in science or in research or in nonprofits or any desire to start a nonprofit, we realized there was an urgent need and felt compelled to do something. And so my family, friends, and I dove in headfirst, and to make a long story short, have come a very long way. We have raised over $8 million. We funded 21 research projects. We spun out a CF gene therapy company. We developed and manage a CF nonsense mutation patient registry for people in that final 10%, and really are racing as fast as we can to expand the incredible breakthroughs we've seen to 100% of the CF community with no one left behind.
So much. We're so fortunate to have you here today. Before we go on to our final panelist, I'm going to ask everyone who is joining, who is not a panelist, to please make sure you're on mute. That'd be a big help. Thank you so much. And then finally, to round out our perspectives of living with and managing rare disease, I'd like to ask Dr. Ray Walsh to introduce himself.
Hello, everybody. Happy to be here today. A lot better to being outside in the cold. But anyway, my name is Ray Walsh. I worked at Albany Medical Center in the pediatric intensive care unit for about 30 years or so, a little more than 30 years. I retired from that job 2 years ago and took a spot at Siena College where I help instruct pre-med students. So I'm working at Siena now. In the course of my occupation, I've had the opportunity to take care of a lot of children with a variety of rare diseases, metabolic diseases, genetic diseases, cystic fibrosis, and many others. I also have a niece who has cystic fibrosis too, who had a bilateral lung transplant done a couple of years ago. And she feels great, but unfortunately she can't do anything because she's still trying to get a COVID vaccine. So she's sort of housebound right now. But anyway, as I said, I've taken care of a lot of children with a variety of different illnesses, and I hope I can make some sort of meaningful contribution to this discussion today.
I know you will, Dr. Walsh. From talking with you prior to today, I know we're going to learn a lot from you and from everyone who has joined us. So to get us started, for folks who have joined since we started, just a few housekeeping things. If you have a question for one or all of our panelists, you can type it in the chat and direct it to me, Laura W. And we'll have an opportunity, hopefully, for Q&A at the end. We have some prepared questions, so we'll start there. Our first question, knowing our theme for our discussion today is about the importance of connection in rare disease, I want to ask each of our panelists if they would describe an important connection that each of you made related to your experience with the disease. You know, that may be a connection with a person, with something educational. I'd like to hear who or what it was and when that connection was made and why it was important to you. And we'll start with Steve as our first panelist response.
Thank you, Laura. I'll give two real quick because I think, you know, we've talked about this as panelists, and I think there's different ways to define community. And I think the first way is sort of your own personal community. I spent a lot of my winter breaks throughout my schooling in the hospital because my mom didn't want my IV tune-ups to interrupt my education, which made sense. But they got quite lonely. You know, you get to an age where people start doing their own things and they go to parties and stuff. And I remember my junior year in college, a dozen of my best friends surprised me on Christmas Eve, drove down from Ithaca in like half a foot of snow to be with me. And I think that was one of the moments in time where I was reminded that this wasn't just my fight, that this was the fight of everybody in my life. And it was just really reassuring. And to this day, I stay close with them to know that there are people there for me who might not be going through what I'm going through, but are there to rest your head on when you need it, to cry when you need it, to celebrate when you can, things of that nature. I think the second piece is, you know, because of the breakthroughs with CF, from a therapeutic perspective, we're experiencing more and more of life than ever before. And one of my most terrifying moments was when my son was born. And, you know, it was super exciting and all that jazz because you created another human. But the reality is caring for a tiny human requires a lot of energy, a lot of sleepless nights, and comes with a lot of stress. And all of those things are a recipe for sickness. And at that point in time, you know, you go on the community on Facebook, the other social media platforms, and establish a pretty close relationship with another woman who had recently given birth to her first son. And there's moments of that throughout their life where it's just reassuring to be able to talk to someone who's going through what you're going through, who's trying to balance what you're trying to balance, who's trying to figure it out for the first time, just like you're figuring it out for the first time. And I think just being able to make those connections with people is critical. The reality is rare diseases are isolating, and there's a lot of uncertainty, and there's a lot of frustration. And just being able to to be able to talk to someone in that capacity with no pressure or no one listening or telling you how you should do it, I think is really important to keep a level head and help guide you as we're all trying to figure out whatever's in front of us from a life perspective.
Thank you, Steve. And so now we'll move to Lauren. Lauren, if you would share an important connection, a story of an important connection and why that mattered.
Yeah, my connection is a woman named Leslie Lucas. She's the executive director of, I have to read this, it's a long one. She's the executive director of the Central Ohio chapter of the Cystic Fibrosis Foundation. I think that she kind of came into that role at the same time I was calling her, so we were both new. And I think I called her, it was like January of 2015. We were, in the process of getting a formal diagnosis, and I didn't even know what I was calling her for. I needed resources for us. I wanted to do something to feel like I was helping, but I didn't know, I don't have a fundraising background. I barely had a parenting background, so I felt really underqualified to do anything. But I called her, and by April, she had me on committees, and Michael was the honorary child of the annual fund that year. And she was the kind of person that was just constantly pushing me to do the next thing, giving me another job. And I think she knew I was really afraid to put myself out there, and she just kept putting me in front of more people. But she also spun my voice. I think at the beginning I felt really disappointed and really scared, and the language I was using was really negative. And she spun everything into what my opportunities were. So, we would kind of talk together about what that meant, and it meant I have the opportunity to work with medical teams that offer proactive approaches to care. I have the opportunity to keep him well. I have, we would take pictures of him at the hospital, and it was, a picture of not a sick child, but a child that is staying well. There's an opportunity in reach to treat Michael before he has any symptoms. And I am dedicated to helping raise awareness and money for CF until there's a cure for all patients. And I think as a parent, I felt like I was part of the problem, or I was the cause. And Leslie was the first person to come in and make me a part of the solution. And that was huge.
Thank you, Lauren. What a beautiful story. So many things layered in there that we can learn from. And so now I'd like to ask Emily also to talk about an important connection and why it was important.
Sure. So I'll share two as well. One is on a personal level and one's on an organizational level. The first on a personal level, it's kind of surprising for people to hear now, because, I'm really involved in the CF community, and, through Emily's entourage, speak out about lots of things, and, speak at events and advocate, and, do and kind of front and center in a lot of ways. But that wasn't always the case. And actually growing up, I really wasn't involved in the CF community. I didn't really have other friends with CF. We, a little known fact about CF is that people with CF actually can't be near each other because of cross-infection opportunities just among people with CF. And so we had always taken those very seriously. So I'd never really built a community of CF friends. And I think also had felt there were some emotional barriers as well. I was very scared to make friends that I could potentially lose to my own disease. And so it wasn't until I was in my early 20s that I actually stumbled upon a blog written by someone with CF who had very advanced stage CF. And I found myself really connecting to her, not just because of our shared CF experience, but because I actually felt like we could be friends outside of CF. There was a lot about her that felt really relatable and that was, likable and sort of spoke to me in ways that were more than just CF. And so, to make a long story short, it was a gradual thing. I started following her blog, and then, she was part of a couple different communities, and I started silently lurking, and then I, built up confidence to say something, and it was, one thing after another. But really, it was realizing that I could connect with people with CF and like them more than just have CF in common, and that was really a light bulb moment for me that opened up the whole CF community, and I'm very grateful for. That's on the personal level. On an organizational level, I think it was 2000, so we started Emily's Entourage in 2011. At the time, we were mostly raising money. We were trying to figure out how we were going to be using the money, like whether we were going to be granting it to other organizations or funding labs ourselves. And in 2014, it occurred to us that actually one of my close friends that I had grown up with, her father was a longtime CF researcher. And, we had always known this, but he had actually moved on and was focusing on other diseases at the time. And so it wasn't ever particularly, relevant to us. And so we remembered this. And so we actually went knocking. We had gotten a proposal from a researcher, and we felt totally ill-equipped to evaluate it. And so, we were very resourceful and remembered that he, that my friend's father was a researcher, and we ended up knocking on his door. And what we often say is, we knocked on his door, and 7 years later, we haven't left. He continues to be, he's the chair of our scientific advisory board. He's been our fearless scientific champion. And it was a pivotal moment in the growth of Emily's Entourage because he opened up the whole scientific community to us. And it all started with us having the resourcefulness and the fearlessness to knock on his door and ask for help. And he's really been by our side every single day since. And so we're very grateful. And it was really definitely a critical connection and moment for us.
Thank you. And thank you for answering that question, both from your personal experience and from your organizational experience, to give us both of those perspectives. Dr. Walsh, what can you share with us about an important connection, either for you as a professional or that you have seen for families and people living with a rare disease?
Okay. One of the things I didn't mention in the intro was that, for over 25 years, I volunteered at the Double H Ranch, which is about an hour north of Albany here. And it's a camp for kids with a variety of illness, some sick kids with chronic life-threatening illnesses. It's part of the Serious Fund Network, which was originally founded by Paul Newman many years ago. And it must be 17 years ago, I started a camp session for children that required various assistance with breathing. It could be a ventilator, it could be something called CPAP or BiPAP, but they needed something to help them breathe. And I started a camp session for them. And I'll never forget this. This was the very first year after the first night of ventilator camp. It is a family program, so family members are allowed to come too, in addition to the child. And after the very first night of our first session of camp, we call it Camp Inspiration, I was talking to a mom, and I said, "How was your night?" And she said, "It was the first time in 7 years that I've been able to sleep without having to listen for a ventilator alarm going off." And just by that line alone, I kind of get a little choked up when I think about it, but just that line alone made me a lot more aware of the sacrifices family members make to take care of somebody in that family who's sick. And it gave me a whole new perspective on my job too, because prior to that, I saw kids in the hospital all the time that were sick, sent some of them home on ventilators when they needed it or other breathing devices. But until that day, when that woman said that, I never realized what sort of a burden we're imposing on these families once they went home. And it gave me a better appreciation for the amount of help they needed once they left the hospital.
Thank you, Dr. Walsh. And actually, thank you, all four of you. I've been thinking about all four of your answers, and some of the things that I heard really are sort of the connections people expect with people in their lives, the people you're directly connected to, but also all the people you reached out to and learned from and have helped over time. The stories you told have already shown sort of that web of connection that we all have, rare disease or not, but certainly the examples that you share show us how each of you has both found connection and probably given connection to other people. So thank you for that. So our second question, knowing that our finger paint team, a lot of what we do is think about what information and resources people living with health conditions, families, and healthcare professionals can use as part of their daily life and their disease management. And so here our question is, what, for each of you, what kinds of information and or support resources do you find to be most helpful? And is there anything that you think is missing from your perspective? And so we're going to go in a slightly different order, and I'm going to ask Dr. Walsh to answer that question first.
Okay, I'm going to answer this from my MD perspective of life. For me, the best resources that I've found over the years is, it's a blessing and a curse for physicians. We all have heard of Dr. Google and so on. But internet access is crucial now to taking care of patients with various illnesses. I can sit at my desktop and have access to CDC information, NIH information, the latest clinical trials that are going on nationwide with various illnesses, and access to electronic medical journals. And it just makes that aspect of my career that much more rewarding, that I can find this out in the pre-computer age, which I entered medicine in the pre-computer age, very primitive back then. It was a real ordeal to find this stuff out. Now you can find it out instantly and hopefully help some families with it. Things that I think are still missing. Number one, especially for children, is home nursing. To try to find nursing assistants at home, depending on where the child lives or the patient lives, can be incredibly difficult. Sometimes, a child's going home, let's say on a ventilator, and all we can get is nursing care for 6 hours a day, which is very hard on the family. Usually we try to get 24 hours a day when they initially go home, but sometimes we can't do that. So home nursing can be a real challenge to arrange that. The other thing is that particularly in developing children and adolescents, to address their educational needs. I know my own niece missed a lot of school from cystic fibrosis, and there needs to be a better way to educate these children when they do have to miss so much school. I mean, if they're in the hospital, they can get tutoring for a few hours a day, but it's still inadequate. Particularly if they're hospitalized at home. A lot of CF patients be treated at home with antibiotics and things like that. And so there's still a hole in the educational process to make sure these children and young adults that have these diseases are able to perform academically.
Thank you. Those are really broad needs and resources, from information to practical support. So thank you. And now we'll turn to Emily. Your thoughts on information that's helpful or support that's needed.
Yeah, I guess I'll answer this with both hats as well. So on the personal side, I am a firm believer that the most valuable asset we have in healthcare is each other. In peer-to-peer health, I think that, in my times of need, often the people that know the most and are the most accessible and the most helpful, and that can be the biggest lifeline, are other people with CF. Not only do they draw on their own personal experiences, but you can tap into, massive networks of crowdsourcing and get information from their doctors and doctors from all, and other people and care teams from, all around the world. And so, in addition, I think that, in a disease where there's, roughly 2,000 different mutations, we all get colonized with different bacteria. All of our experiences with CF are, there's similarities between them, but they present incredibly differently. we all become micro experts of our own bodies and our own conditions. And I think that leveraging that micro expertise and providing ways to connect with each other is has been a lifeline to me, and I think continues to be an underutilized resource. In addition, I think information that is not particularly helpful is, a lot of times larger organizations and pharma companies, industries that are very regulated, have to put out very canned information, and it just is not that, right? It's almost useless. And I think that, for so many of us, we really need our conditions and our situations are pretty specific, and we really need much more individualized guidance, information. I also think that a lot of times there's an assumption that people with diseases need really dumbed down information, and I'm a strong proponent of providing data and research and making the science completely transparent, and that patient communities may have to be educated about how to critically analyze research, but they're certainly capable, and nobody has a bigger vested interest in that information than those of us whose lives depend on it. So that's on the personal level. On the Emily's Entourage side, the truth of the matter is, a lot of throughout our existence, a lot of times we have felt like we are figuring it out as we go. There are no guides out there, and we've really relied on mentorship from others who have done similar work in other disease areas, and experts, multi-stakeholder experts, and sort of keeping our singular goal in mind for every single decision we make. So we run through that filter every single decision we make, and that is incredibly grounding and clarifying for us. But a lot of times we really do feel like we are building the plane as we fly it, and that is liberating and terrifying at the same time.
Thank you, and thank you for speaking so openly about it. You are really helping people learn lots of things that might have been out of their reach before. So thank you for talking about that. We'll turn to Steve next about information and resources.
I'll echo everything Emily said. I think, you become sort of a master of your body, and everything is kind of tailored to your own situation. I think on a personal level, the flying and building the plane of itself also translates to everybody's life. Like, if these drugs are going to make you live longer, then we also need to figure out how to live longer. And that is everything from, I'm like, oh shit, now I need pardon my language, but I'm like, I'm 32 years old, I need a 401k, because I never thought I would actually need a 401k. So there's aspects outside of life that these medicines will help people achieve, and I think that needs to be thought through. The other thing that I think is largely missing is attention to mental and emotional well-being. These diseases can ravage you in ways that I probably can't even describe. And I think that's always been a void in the overall health and care of patients. We go to CF clinics, you see your specialist, you see a nutritionist, you see a gastro, you see an endocrinologist, and then eventually you get to the social worker who doesn't even ask about your mental well-being, but they ask about whether or not you've received all your medications. So I think there needs to be a little bit more of a focus on the mental and the emotional well-being, because at the end of the day, they're all connected. And if you're not in a good place mentally, you're not going to take care of yourself. So I think for me, that's a void that has started to fill in from a community and a focused perspective. But I think it would be great if someone could continue to do that.
Thank you. And now we'll turn to Lauren.
Thanks. That gave me a lot to think about. I've had a different experience. I would say that, from support, resources, and information, our care team is everything, and it is like, it's just a large group of really heavy hitters. We have a medical team in Morristown that we're really lucky to have access to. We have a really amazing pediatrician in Saratoga. We have the Cystic Fibrosis Foundation, which we've been able to work with people within that organization who have been really helpful to us. We have a school district that has been engaged in the situation and has offered resources should we ever need them, and neighbors and friends that have connected us. They're like, I met someone today that has CF, and they gave me your card for you. So I feel like I'm constantly being kind of like I'm being sort of hustled along. I don't think that Michael feels this right now because he has a really normal life with all of these people. But I will also tell you that at Fingerpaint, Gabby DeBlaze is a huge part of our care team. She spends a lot of time helping us navigate what our options are and what's available to us. And it has not even occurred to me that something could be missing, because as I said, we are really well cared for.
Thank you. And thank you, again, all four of you. What strikes me as someone who, and I think I speak maybe for a lot of finger painters, we think pretty much of our time is spent thinking about symptoms and medicines and how someone takes a medicine. That is most of our job. But to hear you speak so broadly about information, support, practical needs, that is the whole life of someone that we're talking about. And it's just a really helpful way for us to hear your stories, that while Fingerpaint has an important place in developing some of that information, that there are much larger needs that can and are being served, and still some opportunities for more service and support. So our final question, and I think these three questions kind of all weave together, kind of getting at similar things through these questions, is we've been talking about connections, we've been talking about information, and now we want to finish up with the idea of, what does community mean to you as someone living with or managing or supporting a person with a rare disease, and why is it valuable? And this time we will start with Emily.
Yeah, for me, community in all respects has been an absolute lifeline. Personally, when I am scared or need information or need support or literally need anything, the people I turn to are my friends with CF who have been there and done that and get it. And whether it's, sometimes it's an immediate treatment decision that I need help, that, you can get such decision fatigue with CF. You have to make so many decisions all the time, often with imperfect information. And so sometimes it's, immediate treatment decisions that I'll, that I'll ask for their advice on, and I trust them implicitly. Other times it's, bigger questions. The amazing thing about the CF community is that many of these people are people I've never met in person. I don't, know how tall they are or know some of the most basic things about them, but I know how they want to die, and I know what bacteria, is in their lungs, and I know the most intimate and personal details of their lives. And I think that form of connection has been essential for me in all ways: the practical, the spiritual, the emotional, literally all ways. I really feel lucky to live in a time where, it's very sad that people with CF can't physically be together safely. Obviously an experience that the world is understanding a little bit more now during the COVID pandemic, but I feel lucky to live in a time where at least, it's not a replacement, but it's better than nothing, having digital technology and these online networks where we can form, different but really strong and life-sustaining communities. It's been just really incredible. I feel very, very fortunate. on the Emily's Entourage side, we are an organization powered by a community that believes that we can do better and that it is up to each one of us to get there. There are, countless members of the CF community that are part of it, but there are also, and I think this is, one thing that is particularly touching to me, the vast majority of our entourage of, 8,000 people are people that have no personal connection to CF, and they're motivated by this incredible human desire to help and to be part of something change making. And I think that especially in this day and age, is such an incredibly humanity affirming thing to see, is how eager people are to open their hearts and jump on board and be part of something that aims to make a difference. And so for me, community feels like the very lifeline of every aspect of my existence. Truly.
Thank you. Thank you so much. Steve, can you tell us a little bit more about community?
Sure. I mean, the easy part is to echo what Emily said. I think it's just reassuring to know that there are people out there dealing with the same things that you're doing. Quite honestly, I don't even talk to them that often, but just going on some sort of social media and seeing what they're doing and seeing what they're achieving and hoping they're doing well is just comforting, quite honestly. I think the other thing that's important from a community perspective is it gives everybody a collective voice. And I think within the CF community, and there's a book, Laura, which I sent your way called Breath from Salt, which really outlines the history of the CF community, how the scientists, the advocates, the parents all came together to really drive these breakthrough therapies that some of us are fortunate to have access to today. And, I sit here and I think I have an active voice, but then I look at someone like Emily, who is out there with one of the most ambitious, loudest, provocative voices that you could see in the community. I mean, I think it was last week she penned an op-ed in a couple newspapers because people with cystic fibrosis had been deprioritized on many of the state lists as it relates to access for COVID-19 vaccines. So I think the sense of community and the sense of, pride and sort of wherewithal that we have for each other is critically important to drive the science, to drive the awareness, to drive the access, because we all should benefit. And I think that's one thing that is probably most unique about the CF community, is that you have such influential patient advocates that are driving real change. And I think for someone like me who doesn't do that every day, it's just really great to see that others are doing that on behalf of us. So I've never talked to Emily, but I've watched her story for, 15 years. And she's a big reason why all of us are doing so well, because it's that voice. So that aspect of community that I don't think we really think about every day, and that singular voice of driving change and influence is critically important for all of us to live with this stuff.
Thank you. Lauren, can you share a story about community?
I feel the same way. I think community for us is all about the connections that we've been able to make. And it's, I feel like the first connection that I made on Facebook was Emily's Entourage. I feel like I don't even know what I typed in, but it came up, and I probably typed in cystic fibrosis, but it came up, and I feel like I've had these very raw moments with her. And I mean, even in just getting ready for this, I am really geeking out to have this opportunity to be in the same space as her, between articles on, a movie came out and she had, a really interesting perspective on, that movie. She just had a video out. Was that called The Thin Line?
Yeah, the magic line.
Magic line. And I'll tell you, I have ugly cried to a lot of the content on her page, but I've been really moved by it, really inspired by it, and really have found a lot of peace and and drive in what she puts out there. I don't have the ability to do what she's doing, what that group is doing, and it really is an inspiration to and like a call to action, really, that I think some of us need sometimes. She's a big motivator for me, but you know, that CF community, that the people that provide all this information, and then also the people that are around us that just constantly check in and see that we're okay. There was a pandemic that impacted people's breathing, and I can't tell you the amount of people that felt compelled to reach out to us, or we tried to raise funds with the Mighty Mickey group, and the amount of people that showed up and bought a shirt and participated, and didn't just participate because it's a good thing to do. They participated because they wanted a cure for Mickey, for us. So I feel like community has really been connections for us on very personal levels, and then also like in this like universe of feeling in something where we would normally be really isolated, feeling like we are really a part of something powerful.
Thank you, Lauren. Thank you so much. Dr. Walsh, any comments on community, either professionally or the families that you've worked with? Dr. Walsh, I think you're on mute.
Okay, I'm unmuted now. Sorry, common mistake with me. I'm going to sort of take a broader view of what community means in the context of things I and my colleagues have to do when we discharge a patient who has to live with an illness. And, you know, everybody mentioned friends and neighbors and family members, which are probably tops on the list. For us to send a person home that's got a certain illness that they need to live with now, certainly the friends, family has to buy into it, that this is what the way life is going to be now. And they also need to have some friends and neighbors that are willing to help out. Nobody can take care of somebody 24 hours a day by themselves. There's times you might want to go out to a movie or a restaurant when those open again. And it's always nice to have a neighbor or friend you can depend on to cover for you if you need that done. So friends and neighbors, yeah, they're of prime importance, but there's other things too that from a doctor's standpoint that we had to look at too. The other thing we had to do whenever we sent a patient home with an illness, we wanted to make sure that the local EMS chapter was aware that this patient was going home. So that if something did happen, had they gotten worse or developed some of the complications, the EMS people would have noticed that, hey, this person living at this house has this disease. We need to get there, and this is what we need to do when we arrive. So we want to make sure EMS was aware of this. The other thing is what we call ancillary medical services. And we used to have to line those up, things like speech therapy, physical therapy, occupational therapy. And that's part of this great community too. The other thing we had to look at was pharmacies. We had patients from fairly remote areas up in the Adirondacks and things who were sometimes on exotic medications. And we want to make sure that the pharmacy was able to either had them or was able to prepare them if they didn't. So we'd have to contact the local pharmacies or the pharmacist, the pharmacy the parents used or the family members used to make sure they could supply these drugs to the patients. And if they couldn't, then we'd have to make other arrangements somehow to get the medications there. And finally, in the big scheme of things, there are people who literally, as I said early on, give up their lives to take care of a sick family member. And there needs to be some form of financial support to help these families out. That's part of the community too. It could be fundraisers, it could be through organizations and things like that. But it also needs a bigger participation by perhaps the local government, state or federal government to help these people out. I'll give you an example and then I'm going to shut up. My mother-in-law developed Parkinson's disease. And my wife gave up, she was a teacher, an elementary school teacher, and she gave that up to stay home. We didn't want to put her in a nursing home or anything. And she gave up 2 years to take care of her mom who lived with us. And I kept thinking, like, financially we're okay because I was working. But if I wasn't, or she was a single person trying to take care of her mom, I don't know how she would have done it, and been able to pay bills and things like that. So there needs to be a greater awareness of the financial support that people and families who are living with somebody with a chronic illness, they need to be aware that they might need some extra cash to help them out and get through this. And all of that's in the bigger context of what can we do to make life a lot better for these people who need to live with this illness and live as best they can with it. And we need to help with that.
Thank you, Dr. Walsh, and everyone. I have this image, starting with you, Dr. Walsh, but sort of everything you've all just said is sort of like ripples or rings in a pond, you know, of each of you as individuals and families, and then really communities affected by chronic disease or rare disease, and the supports that are sometimes invisible and yet very necessary. So thank you for, you know, giving us that really broad view, all of you, into that. We have just a few minutes left. We have not gotten any questions because I think that means you guys are doing such a good and thorough job. But what I'd like to do is offer, and this is optional, if any of the four of you panelists would like to have, you know, sometimes we call it our soapbox moment, meaning this is your opportunity to talk to us as finger painters, people involved in healthcare and health communications, and just as humans. Is there anything any of you would like to leave us with, sort of a parting thought about how we might learn more about rare disease from something that you shared today? So if that's something you're interested in getting on the soapbox, just raise your hand and I will call on you. Dr. Walsh, great.
Not a soapbox, but it's just going to be one line.
Uh-huh.
And everybody who's watching this, I just want to leave you with this one thought, is that people cannot do this alone. That's all I'm going to say.
Beautiful summation. Thank you. Thank you. I see Steve has gone off mute. I will take that as a hand raising.
Yeah, I got two things. Never underestimate what it takes to get ready for the day. There's a lot that people don't necessarily see, just so that people with rare diseases and cystic fibrosis specifically can get to school or get to work. It's challenging. So I think keep that in mind. The second thing I want to say is, and Laura, we've talked a little bit about this, and I think you referenced it a little bit ago. We often work in the context of the patient journey. And I've told you, I've started to loathe that term more and more, because we're looking at someone's life, and the medical component is just a part of that person's life. And this person is trying to navigate everything that is in front of them while staying healthy. So I think we should just be cognizant of everything that a patient or a person living with a disease is dealing with, and how that influences the choices and the decisions that they make from a health perspective.
Thank you. Yeah, I love that more well-rounded perspective, Steve. Thank you so much. I'll offer Emily. Looks like you might want to share something. Thank you.
You know, I'll just add to what has been said before, is that at the end of the day, nobody has a bigger vested interest in our outcomes than those of us with diseases and the people that love us. And so, you know, I am a strong believer in, you know, participatory medicine and really the importance of patients and families being treated and respected as the drivers of their care that they are. The vast majority of our healthcare happens outside of clinics and outside of hospital rooms. And so I guess my advice, you know, along those lines is that if you want to know about life with an illness, and if you want to understand an illness, the people to go to are the patients and the families. I know patients often is even, you know, a dirty word in this world, but, you know, the people with the illness and their families, they are the experts that live this with every single breath they take. And so, without knowing, tons about what finger paint does, that would just be my sort of my advice. When we work very closely with lots of pharma and biotech companies, and what I always tell them is that, increasingly patient centricity, et cetera, is becoming such a buzzword, and that's not about running your clinical trial protocol by a patient and getting their check of approval at the very end stage. That is everything from idea, concepting, prioritization, through, formulation of medicine, clinical trial design. Like, it's every single step of the process. And it's not about lip service. It's about really listening to the needs of the patient community and family community. So that's my 2 cents.
Beautifully said, Emily. Thank you so much. It's a final chance if anybody else has anything to add. But if not, I sincerely want to thank the 4 of you and the finger paint team who put this all together. I think it's been one of the best hours I have had in a very long time, just hearing your thoughts, appreciating your preparation. And I imagine, all of us will take away some really important things from your time today. So thank you all very much. I wish you all a great day. Thank you.
Thanks for inviting me. Have a great weekend that's coming up.